I have prepared basically my personal experience and my colleagues and doctors that I guide. And for the moment, this expresses rather my approach and personal experience than the official literature, despite I have some information from the general approach of some protocols of other hospitals and other colleagues which are who are not in my group, but 80% of the results and the protocols is what we do. So, and I have chosen the gastrointestinal functional disorder because as a, for instance, fatigue syndrome, which was lately in my presentation, I think that gastrointestinal functional disorders are in general well accepted, and the success rate of the therapy and the outcome for the patient is quite positive, and the results without the chemical drugs are not so questionable, because for instance in the cardiology, which we had before, seminar on cardiac disorders, the standard medicine deals with cardiac symptoms fairly well, on lowering the blood pressure, on regulating arrhythmias and so on. So in cardiology you face quite a strong opposition from the standard medicine, despite the peptides in cardiology are much more efficient, but it's difficult to advocate. In the case of gastrointestinal functional disorders, all the game is ours, because standard medicine has very poor results with outcome for the patient, and the standard chemical pharmacological solutions have lots of side effects. So the territory for us, alternative treatments, is with alternative treatments is very wide and well tolerated and well accepted, and even from the standard medicine, because patients who suffer from the functional gastrointestinal disorders, which is probably 40% of the population, 30 to 40% of the population of the Western world, they realize that conventional therapies fail, and the enthusiasm of other solution is quite substantial from all the community. So the medical doctors who treat in the classical way use lots of brutal diagnostic tools like gastroscopy, colonoscopy, and they may harm much more, because this harm can be done from physical injury caused by endoscopic treatment or endoscopic diagnostics. And apart, it's unpleasant. Some of them have to do it in general anesthesia, and the outcome for the solution is, except surgery, is minimal. So my response from the patients is that they prescribe them some chemical drugs, but they tell to the patient, you know, we don't know how much is going to help, and what's going to be the result, and you have to come again, and so on. So, like for instance, in cardiology, they tell you this beta blocker will drop your blood pressure, and it's going to save your life and prolong your life. In gastrointestinal disorders, it's not so radical, and even standard doctors are quite doubtful about the result of the medications that they prescribe. The alternative practitioners have much better results, and in United Kingdom, the alternative medicine, they call it complementary and alternative, have better results in 48% than the standard medicine. So that's quite substantial. And also in US, it's more and more growing. So the estimate that the patients spend $40 billion on non-conventional or alternative medicine, which is always paid by the patient. So the result, if the patient pays, the result is much more required or controlled, because basically if the patient doesn't pay, then doesn't give any contribution of his own commitment to the therapy. But in the case of the paid service, the reliability of collaboration of the patient is much higher, because for the moment we have seen that people stick more to the diet and more to the lifestyle rather than those who take chemical drugs. You know, the etiology is always the biopsychosocial model, you know. So I mentioned genetics, but rather I mention epigenetics, because there is no gastrointestinal disease that should be strictly linked to genetics. But there is an epigenetic transposition. So if my father had it, I might have it, you know, my grandmother had it. And this is the activation of epigenes, which are for the moment considered as a genetics, because standard medicine, don't forget, doesn't make the difference between genetics and epigenetics. So that's for another lecture. Then you have lots of psychological factors, you know, which is the early life trauma, psychological state, education system approach to the daily routine, and so on. And then from this stress, we have the disturbance in gut-brain axis. That's what we discussed in my previous lectures. It's extremely important for the healthy patient to have fully aligned gut-brain axis, which would be, for the moment, relatively in alignment with the food, environment, and so on. And of course, at the end, you have environmental stresses, which are infections, extreme use of antibiotics, because people rarely reject antibiotics. Maybe now there is a growing, in millennials, there is a growing line of generation that is very careful about antibiotics, but the prescription level of antibiotics, which is worldwide medicine, is quite detrimental. Then the last and not the least is the diet regime, because strict follow-up of appropriate food intake is extremely difficult to sustain in the civilized society. Now maybe when it has slowed down, people will be more careful. But you always, when you have a patient with gastrointestinal disorder, you have to go through all in anamnesis to find out all the causes, you know, from the psychological factor, gut-brain axis, and the food or the environmental factors, because this will give you the guideline what peptides to use in what case and in what sequence. And especially in the antibiotics, it's very important to start with the detox, which we have in the line. Then the patient also responds very well to the peptides, because when you explain them, it's natural and it's not chemical. So this already, when you see interest of the patient in this type of therapy, then they are very much more cooperative, and this gives the sense of autonomy to the patient in the care. So you have two types of patients, those who come and say, doctor, treat me or fix me, and the others say, what do I have to do to get better? So those who are at the moment in the position asking you to fix them, you should reject them, because it's not for the peptides. But those who are asking, what should I change, what should I do for my improvement, then you have a patient who is taking responsibility of his own life and of his own structure of diet, and is collaborating. Then it's very much worth to treat him, and you will always have very good result. So we always use as a startup a part of the detox, which I mentioned before. You have the one which is the nerves and the liver. Everyone who comes with indigestion has always a liver problem, always. So you always mention the possibility of the antibiotic therapy. If you have antibiotic therapy, you give liver, nerves, and detox. Also, what is very important is adjoining hypnotherapy, mindfulness, exercises, cognitive behavior therapy, whatever, because the brain is directly linked to the gut and vice versa. So you will help by detoxifying and increasing function of the liver, and then after that you start with follow-up of the therapies, which we will discuss later. But the indigestion is basically about the liver as the first choice, and the nerves, because whatever is causing the problem, it's always always the nerves. One of the most frequent which you find from the stress people is the reflux or heartburn or esophageal erosion, because people eat lots of acid food, and they have not enough time between the meals, because it should be minimum 6 to 7 hours, and you have and then they poorly sleep, so for to calm down the reflux, the acidity, so you use the hyperacid. And the nerves for the sleeping, it's always in the evening, and it helps substantially, because when you sleep well, you are less irritated in the morning, and your acidity is decreasing. And the third one is the vessel, so it should increase the microcirculation, because every heartburn or esophageal erosion is linked with a lack of microcirculation. In this case, microcirculation is basically the key for restoration of health. So in the moment, once you have any type of gastrointestinal disorder, vessel and nerve is essential, because if you imagine that the enormous blood flow of capillaries, which is linked to intestine, stomach, colon. So you put, and as we said, you always give for the bigger weight and men 2, and for women and younger adults, you may have 1. The problem is that when they have the heartburn and reflux, so you have actually 6 capsules in the morning and 6 capsules in the evening. In the extreme case, it might be 6, 6, 6, 3 times a day, but it's very rare. But in general, if you have the heartburn, don't use the acidity or tell the patient to quit this various type of anti-acidity chemical drugs because they have a very serious consequence in possible heart attack. And this works very well, and especially for the younger people who are very active and very stressed. So in this case, you must give the nerves. Now, for the pathogenesis of the disturbance, it's always very important to understand the disturbance in motility. You know that how the intestines move is essential for life, because if your intestines stop, you have 6 hours to be operated and to renew the function of the intestines, otherwise you die. So it's quite important to prevent this event, and when you have already mentioned in anamnesis the disturbances in motility, you may consider that there is an altered mucosa, and when there is altered mucosa, there is alteration of immune function and the disturbance of gut microbiota, and all the visceral signals that goes to the brain are different. That's why you may have lots of psychological symptoms in the patient, which doesn't have anything to do with his psychiatric examination, but it goes rather for the intestine. So anyone who comes with a psychological disturbance, you always have to consider first examination of the gut. From the symptoms, that we have the gastroesophageal reflux we discussed, then functional dyspepsia, gastroparesis, and irritable bowel syndrome. Then, of course, constipation, diarrhea, and fecal incontinence. Constipation is much worse than diarrhea because constipation doesn't allow you to have enough space for detoxification. And as you know, for the moment, you have basically, for the moment, I would suggest that you have some kind of laxative, right? But microflora is the first choice when you have somebody with the current symptoms. You always have to care for the microflora or some kind of probiotics. But probiotics are very dangerous because you have prebiotics and you have probiotics. And sometimes if you don't have enough of the examination, what kind of bacteria, what type of microbiome is in the gut of the patient, you may harm this certain type of bacteria. That's why microflora is absolutely safe, and you may prescribe it to anyone because, and in let's say 7 out of 10 cases, you achieve quite a substantial result. Meanwhile, for the probiotics, it's not secure, as I said, for this reason. Now, this is that bacteria is extremely important because the latest papers show that the ratio between the bacteria, human, and viruses is 1 to 10. Now they say it's 1 to 1. But what you have to consider that the microorganisms are much more important than it was till now considered, and especially we are living with lots of viruses and bacteria for millions of years. So any disturbance that is done without any cautious can harm. So probiotics is not so easy to prescribe in general. So I would suggest that the microbiome is like a fingerprint. So you have to always consider very thorough prescription of probiotics. Meanwhile, every one of you once a month, or 1 month yes, 1 month no, even if you don't have any symptoms, even if you are absolutely fine, you should take FLA2 or microflora as a prevention, because it's the peptide that gives the kick to the appropriate bacteria and settles the whole balance of the microbiome for the healthy one. So you may use it as a prevention for the children, for everyone, and especially in the elderly people, but that we will discuss later today. Because you have to maintain the immunity and homeostasis, and immunity and homeostasis is maintained only through microbiome. That's the key, and as you may have heard from the Chinese medicine, that when I studied acupuncture, they say that if your colon works properly, you cannot have any disease. But if your colon doesn't work well, you may have all diseases in the world, and that's where it starts. So even Chinese knew it 5,000 years ago that what we call now microbiome-gut-brain axis is very important. And you may switch, take the FLA2 and microflora for prevention. And especially in these difficult times when all media are trying to explain how much we will be endangered by this certain type of viruses. So as a prevention, you may take the FLA2 and microflora, and that's the first aid which will never fail. And especially it's going to restore your gut-brain axis. And of course, if you believe that there might be some types of viruses that can be harmful, you add the brain peptide, which is the brain tide plus, which is helping you to settle to the appropriate conscious attitude. So that's here is the functional medicine scheme. So we start with the central nervous system, which receives the information. The central nervous system goes through nervus vagus to enteral nervous system. And enteral nervous system sets microbiota. So you have to know that we have a central nervous system and enteral nervous system, and these two systems work simultaneously all the time together. And whatever reaction of stress, which is hypothalamus, pituitary, adrenal axis, that's what we discussed at the very beginning, is regulating immune system. And this is all reciprocal. So immune system is regulated by microbiota. Microbiota goes and regulates the gut-brain axis and sends to the central nervous system information how to approach the problem. The problem can be infection, the problem can be hunger, the problem can be thirst. So all this is regulated by vagus and hypothalamus pituitary adrenal axis. And then they regulate immune system through microbiota. So you may see that microbiota through gut-brain axis goes to the central nervous system, and then enteral nervous system regulates microbiota and sends through the nervus vagus information back to the central nervous system, to the brain. Now, the information that goes from central nervous system to the enteral nervous system is probably 1/10. So you may imagine that you get 1 megabyte of information from brain to the gut, but 10 megabytes from the gut to the brain, because microbiota is regulating all your life. That's why it's so crucial to have this regulation in full alignment. And then when you have it in alignment, you may eat what you want and you may drink what you want and you will never have any problem. So this is very important that you realize there is a histologically confirmed enteric nervous system, and that reflects the central nervous system. And it's impossible to have a central nervous system without enteric nervous system. And the outer plexus, which is called the mesenteric plexus, is involved in the regulation of the smooth muscles. And that's called peristaltics. And then the submucosa plexus is responsible for secretion and absorption. You cannot believe how much, when you do the appropriate molecular examination of the peptides and the receptors from submucosal plexus, how much you can foresee the colon cancer. It's probably 2 to 3 years ahead. You may diagnose the possibility of colon cancer on the basis of secretion of information from enteral nervous system in submucosa, because this is modulated by extrinsic innervation coming from the central nervous system, right? So for this moment, the so-called examination of occult bleeding, it's probably the very last and very late examination, because when you start to have the occult bleeding in your colon, the whole system of regulation has been impaired. So maybe it's good, but there are so many examinations that can foresee that you are going to have the colon cancer probably 2 years ahead of time. So from this point of view, I would be very reluctant on diagnosis of the occult bleeding, because that makes very little sense when it's so late. And of course, this confirms that why we have to always apply the vessel, because when your capillaries are impaired, then starts this occult bleeding, and the capillaries which are not functioning well cannot provide enough information for the secretion and absorption, because it goes all from the microcirculation. So from this point of view, please note that there is not one brain, but there are 2 brains, and these 2 brains are actually one system. So if you operate neurosurgical operation on the commanding central nervous system, it will have a deep consequence on the enteric nervous system, because you can't do any treatment of central nervous system without enteric nervous system. This is absolutely key, and that's why you always have the FLA2 microflora and nerves and brain as a prescription. So you have emotional stimulus. You know, this is the emotional response. You know all very well that when you have a difficult examination, difficult moment, you have in your gut certain type of feelings, and you may have diarrhea, you may have vomiting, you may have nausea. So lots of people who have this before any stressful situation actually activate this mechanism, that your emotional stimulus, which is the fear, which is the poor adaptation, sends the information to thalamus, and thalamus via the thalamo-cortico-amygdala pathway, and the amygdala has stored all your traumas. It's a hard disk, and corpus amygdala have corpus amygdala has the most the biggest storage of our lives, and basically you have charged with the emotional stimulus what amygdala will produce. So an amygdala will send it where? To intestine, first to the intestine, and from intestine to the brain. So the triggering information comes from the brain, but it's executed through the intestinal pathway. Then the anterior cingulate cortex has a central role in this thalamo-cortico-amygdala pathway, and anterior cingulate cortex detects the conflict between the current emotional status and the new stimulus that can incite a new affection and motivation response, which we discussed in my lecture for the stress, that it has been, you know, very important how much you are prepared to be in the position of observer. If you engage yourself immediately in the situation which you cannot handle, then you have a diarrhea, like or you run, or but it's basically the relaxation of the all toxins that has to go out. But when you have when you are in the position of observer, you don't activate adrenals, yeah? And the prefrontal cortex, where you have the further processing, takes a place. What we discuss, how how we're gonna move again to respond to the stimuli. So the less you gonna move to respond to the stimuli, the better for your health. And this is general approach why you should take the adrenal, because people who are overreacting are exhausting the adrenal glands, and then you have this disturbance of the exhaustion of the adrenal hypopituitary axis, and then your adrenals do not work on demand but by default. And demand is important because sometimes you really need your adrenals, you have to run, you have to do something quick. But if you don't have it under control, then your immune system is sending through adrenal axis information to the brain, brain to the gut, and gut stops production of immune peptides. So you have to replace them, and adrenal type plus should be the one to calm down your overreaction. And of course, again, the brain and the nerves. Now, it's very important to know that corticotropin-releasing hormone, which you may examine when you have somebody with a high level of corticotropin-releasing hormone, you immediately prescribe the treatment for the gut symptoms, because it affects directly motility and sensitivity. And it's very important, what I mentioned here is the interleukin 6 and interleukin 8, because these are the inflammatory hormones. And if you have somebody with an irritable bowel disease or irritable bowel syndrome, you have extremely high response to inflammation. And when you prescribe the corticoids like methotrexate or diprofos, it lowers initially the response, but then because the mechanism is fairly well linked with the stress mechanism of the response to the stimuli, it overcomes. So then the irritable bowel disease, they have the immunosuppressive treatment for a while, but then it usually fails. I've never seen somebody who would be on the long term, because then you add another type of immunosuppressant, and you never achieve restoration of the balance. Of course, this is extremely important to balance with the psychotherapy of trauma therapy, psychotherapy, cognitive hypnosis, mindfulness, whatever you may use, but it's you can't fix any patient with the irritable bowel syndrome without hypnotherapy or psychotherapy. We had a very difficult case with irritable bowel disease, and it was the boy who was supposed to study. He was like 24, and he was supposed to study some technical university, and he just disliked it awfully, and he was always sick and always with diarrhea, and I can't go to school. And then we find out, well, what is your wish? And he said, I would like to be a conductor on the international trains. That was his dream from the early childhood. And so during the therapeutic procedure on the holidays, he was hired as a conductor for this long distance trains. And in 2 months, without any medication, of course with the peptides, but injectable. So because he could not be on the long train shifts without the possibility to control the diarrhea. So he had injectable peptides, once every week. And in 2 months, he was absolutely fine. I mean, in September, so he quit the university and he started to work in this job. So I'm just saying this example for emphasizing the importance of the overall treatment in the aspect of understanding the social biome of the patient. Yeah, this is so you always use the microflora and immune, like for instance in the adrenal to calm down the stress, microflora to restore the microbiome, and immunity, because as you see on this graph, the stress is directly linked to the intestine and liver, yes, because you have the microbiota also of a liver. So the liver has to respond with the intestine, and then the liver will selectively produce the psychoactive substances which will irritate the brain, and the brain will irritate backwards the intestine. So I think this picture is showing the best how is the link of the gut-brain microbiome, because the importance of the liver, intestine, and the brain is for treatment of any functional gastrointestinal disease absolutely essential. Now, because you have lots of neuroimmune interactions, which are currently on a big scale, which is Alzheimer, which is Parkinson, which is multiple sclerosis, amyotrophic lateral sclerosis. So the picture before shows you the importance of regulating the immune system via the gut. And when you have these neuroautoimmune diseases, so we have the nerves, we have the brain, and immune. But you always, before you go to the nerves and brain, you start with the microflora and FLA2 and immunity. So these two should be changed with microflora and FLA2 for the beginning, and then go to the nerves and brain. But you can't fix any neuroautoimmune disease without fixing the intestine. That's absolutely essential. Now there is lots of pain syndromes, because pain is a status of the brain, guys, and the pain is always linked to the mechanical stimulations. You know, like people tell you that they have the incredible cramps or distension, stretching, ischemic pain, infection, and all this goes to the release of inflammatory mediators such as prostaglandin, adenosine triphosphate, histamine, serotonin, bradykinin. And of course, these work either to heal you or to kill you. The question is to what extent you want to work with the psychology of the patient, but the help would be always in calming the intestine, and like when we have, for instance, the chronic duodenitis, which is typical psychosomatic disease or functional disease. So you have peptide directly leading to duodenum, nerves, and vessel. The microcirculation, it's the key. So you have nerves, you have microcirculation, and you have microbioma, which is microflora and FLA2. And when you have this balance, then you have always the organ-specific peptide, which is in this case duodenum. Yeah. So of course it has to be linked with the diet, and but this is the solution which you have as a stabilization treatment, because you have to have first always what we discussed at the beginning, microflora, FLA2 for some time, eventually the protection for the infection. Now the microbiota as a key player in the gut-brain axis is also responsible for lots of diabetes too, right? So because the diabetes 2 is actually a disease of improper lifestyle or improper eating habits and or improper food structure. So with what we have been finding is that about after 40 years of age, about 70% people have a very low level of pancreatic enzymes. And there has been several pancreatic products on the market, but it supplies the enzyme externally. So the endocrine function of the pancreas is decreased. So because pancreas is not only insulin, but pancreas is also lots of other enzymes. So when you have the vessel, because pancreas is linked to lots of blood circulation, so you increase the microcirculation, and you have to increase the pancreas flow. So the microflora is essential. So in this case, you start with, and depends what is the stress level. So you may eventually add 2 tablets, two capsules of the nerves for the evening, and to have a good sleep. Because don't forget that calming down is always very important for the sleeping pattern. Yes, the dysbiosis is absolutely important in any pathogenesis. So that's what we discussed before. You start with the liver, microflora, and FLA2. And what I mentioned also is the protection, because protection is lots of people who took the antibiotics have lots of fungus, no? And the fungus is causing lots of inflammation, and of course long-term fungus in gastrointestinal tract brings you consequences in the oncological diseases of colon. So you start with the protection. If there is evidence of any fungus, and it can be in women, the gynecological problems. In men, it's the fungus of the nails. So you always have to have the complete picture of the patient, and then you start with protection, and after that liver microbiome, and if there is an anamnesis of microflora, if there is an anamnesis of antibiotics, you start with the detox, because the detox helps a lot to the liver. This is about the probiotics, what we discussed before. The question of the probiotics is quite specific, because people, I don't know if you have heard, but food supplements market is the biggest in omega-3 and probiotics. Probiotics is absolutely #1 blockbusters of every food supplement and pharmacological company. And with this type of products, they cover the most of the cash flow, because everyone is taking probiotics. And I repeat, it's quite dangerous, because despite they have been found in the gastrointestinal and immune system disorders, you must be very careful how to prescribe them. But if you know how to prescribe them, they are extremely efficient. And what we have noticed, that when you do the proper examination, you prescribe proper probiotics and prebiotics, and you add some peptide like FLA2 and microflora, it works 10 times better than the probiotics by itself. Because the probiotics have always the question of appropriate. Yeah, here I mentioned the antibiotics. So yes, and antibiotics have been shown to influence the psychiatric behaviors because that's so important to be cautious about taking antibiotics only in the extreme case that when you have the mucosal inflammation and visceral hypersensitivity after antibiotics, again, you have to start with the detox and protection. And of course, there is the question of the parasites, because people who eat lots of raw vegetables, who knows where from, there can be parasites. So we have noticed also the importance of the parasites, and I think MyRealWay will already has launched anti-parasitic specimen. So in this case, you have to be very, very careful for the acceptance of any prescribed antibiotics, only in the extreme life-saving indication. Otherwise, I would be now, this is already a question, so I will read it once we finish this. Yes, this is also very important that the peptides can be considered as a very important complementary treatment as an anti-aging strategy of the elderly people. What is the problem is that people of the advanced age have a very low level of enzymes and very low acid, stomach acid, so they digest poorly what they eat. And of course, because hardly any one of the patients we had some substantial support in detoxification, then nobody of my patients, when I ask them how many times do you do the detox, they said never. So when you are 70 years, you really cut off your time of life extension. That when you have a proper diet, which is essential for longevity, and it's the caloric restriction, then you must have the probiotic like effect of the food, not the probiotics that should be sent to directly to your intestine. And but selected food with the mushroom, which are very good. And for instance, for the probiotic, appropriate probiotic food is that you have the green salad, but the more vegetables you have, the better for the gut. If you have only lettuce, it's okay, but it's not good for the gut, for the intestine. So you must have lots of types. And combined with some type of fat, which is avocado, right? It's a superfood. So when you have a salad with 3 or 4 types of greens and some cucumber and avocado and some onion, that's absolutely perfect. Of course, in the appropriate dose, and it should not be cold but the room temperature, because remember that for any food which you eat cold, it's bad for the stomach, because it has to be warmed up to your body temperature and then digested. That's why people get exhausted from the enzymes for digesting raw meat or cold meat. Cold salami and all this is absolutely disastrous. So that's why you have to the elderly people prescribe the pancreas, the low acid, and the detox. for a long time, which means like you have 3 in the morning, 3 in the evening, and before or after breakfast and after dinner, so it helps to digest very well. But this is prescription like 3 months yes, 1 month no, 3 months yes, 1 month no, and so on and on and on. So as a conclusion, I would like to emphasize that any type of gastrointestinal disorder is always linked, that you should consider that there is a gastrointestinal and nervous system. It's utterly stupid to, when you have a gastroenterologist that doesn't look at the microbiome, when you have a hepatologist that looks only on the liver, and the liver lives without the intestine, because you always have to consider that there is the nervous system and immune system, which are like a mirror, and the microbiota. So understanding this, what I have explained now, is absolutely necessary for treating any other diseases which could be a consequence of this main disturbance of microbiota in the gut. So that would be. So now we have an interesting question about the patient who is 17 years old and suffers from neurological problems, headaches and focal convulsions. And she has been diagnosed with encephalitis 10 years ago. And the convulsive situation is drug resistant, which is obvious. So support her with the homeopathic drugs and supplements. And we are aware of the peptides. Do you have any proposals? Yes. Okay, so regarding the what I mentioned, that any neurological problem is always linked to the microbiome of the gut, and the headaches is a microcirculation, so there is a disorder between the regulation of the stress and the capillaries of the brain and capillaries of the gut. And this is probably what I have mentioned before, a typical case that the inflammation in the brain sends poor results or poor signals to the gut and vice versa. So in this case, I would suggest that you have quite a bit of regulation disorder, not only on the level of the central nervous system, but especially on the gut. And I will, if you can write me more about this patient on my email, which is on this presentation, so we will discuss it, because this is too so if you send me more about the information about the daughter, and we can prescribe. Now the other questions: advice for early rheumatoid arthritis in young adults, secondary fibromyalgia. Fibromyalgia is always circulatory disorder, and such a young chap, there must be some kind of deep psychological trauma or toxic trauma. So for the rheumatoid arthritis, and I don't know what he's been taking, but I would suggest that the question is of detox, joints, and microflora. But if you send me some more, because this is not enough information, because we must have look at the overall complex of the patient, because for the moment you have 3 or 4 symptoms, and we have to look for the cause, and then So, but definitely the vessel would help him because it's a microcirculation. The joints, because it's related to the arthritis, and the microflora as the first aid help. But otherwise, the rest, write me an email. No, what would be possible? So if you write me, I will gladly respond, and I will give you more information on the basis of the detailed anamnesis. So we have elapsed 1 hour. I don't want to keep more of your attention, and I hope you enjoy it, and see you in my next seminar in a couple of weeks. Thank you and goodbye.